when we started to develop the program, we started off in one county in New Jersey, and we didn't have any data that says it was going to save money or any of those kind of things. We had data that said my quality of life has changed dramatically. I am using X less than I used to do. This is all patient self-report, but it was hope. That's one of the things I learned early on. As long as people have hope, there's hope. And so when you start seeing those kinds of statistics coming through and people are saying they are getting better, they are getting better. We also look at the data end of it. What we're seeing now is total medical expense, it reduced by 20%. That's huge. Huge. These individuals are generally running medical costs that are 3 times someone who doesn't have a behavioral health issue, 3 to 4 times. So we saw the total cost coming down. We saw 51% reduction in patient utilization, 27% reduction in emergency room visits. But it all started with how the patients actually experienced what was happening with them and what the outcomes were from their perspective. Do the right things and the money will follow.
Welcome to another meeting of the minds with Wobot Health. We're actually partnered with the Future of Mental Health to bring conversations about some of the innovations that are happening in the behavioral health space. I'm really excited to actually bring on Suzanne Kunis, who is the president and CEO of you don't hear me use that word very much, but I'm going to say a disruptive organization called NovaWell, and also serves as the vice president of behavioral health for Horizon Blue Cross Blue Shield of New Jersey. Now, for folks who've been watching, there's a great interview that we did with Tracy Paris Benjamin of BCBS Horizon as well. She's since moved on, but the interview lives on, and you'll get a great example of what it looks like to run a boots on the ground health equity intervention program. So lots of exciting work coming out of BCBSNJ, and really excited to dig in with Suzanne about what it means to raise the bar in mental health. So at the Future of Mental Health Summit, I had the pleasure of seeing some of her presentation this morning before we jumped in and started podcasting, but something really stood out about what she said, which was community health is the mother of invention. Now, we've heard the quote, necessity is the mother of invention, but I love that spin. And Suzanne, I wonder if that kind of relates to NovaWell, its mission, and maybe you could give us an intro and how it relates to that concept around community health.
Sure, happy to do it. So when I started at Horizon 7 years ago, we were trying to develop a strategy for behavioral health. Their strategy up until that point had been, we're going to outsource behavioral health management to another company, and had a vendor relationship. When I came, it was, look, we really need to develop a strategy that is going to take advantage of whole person care. It's all about treating people as people, not health conditions, right? So, I was blessed to be able to start this organization up from scratch. I got to hire my dream team, which was absolutely amazing. These are the most incredible people in this industry, as far as I'm concerned, because our mantra has been do the right things for people and the money's going to follow. Mm-hmm. And so we've spent all of our time focusing on doing the right things for people. So when we talk about what our mission at that point in time is, it was a couple of things. One is we're in a health plan, and health plans are, people know how health plans are lumbering giants, not real innovative, and those kinds of things. And what we wanted to do was to say, we have to change the philosophy of the organization to really focus on how physical health and behavioral health have to work hand in glove. And really, again, no matter what door a person comes through, that they would be coming through a door that's going to think about mental health first. So that's kind of one of the pieces of the work that we did. The second part was looking at access. Access is such a huge issue. And I like to think we were visionary, but right before COVID, we actually started looking for virtual solutions that could help us. And we had a hard time finding any. And now there are thousands and thousands. But anyway, we developed a digital front door, which will allow people to go in to get information, education, podcasts, videos, et cetera. But it also has assessment tools built within it that will get them to the point where if they need help, we will be making recommendations to providers that we've contracted with in our ecosystem, evidence-based, best in class, et cetera. It'll also give them other tools that they can use. It'll also give them the opportunity to talk to somebody who can help them directly. But the third part of it is saying, if we're trying to integrate inside, we're trying to provide access, we've got a whole population of members that are really sick. They either have serious mental illness or substance use disorders, and those are people who have fallen through the cracks forever. There's from a respect standpoint, as these people are not looked at as stand-up citizens in this country. They're looked at people with moral failings, or they have been for years, and so unfairly treated And we thought we've got to take an integrated approach to those members as well and really make sure we handhold and engage them and keep them in a place where they're going to want to keep getting help. So you talked about community mental health. So that's exactly where we started, because when you look at individuals with substance use disorder or serious mental illness, they're not going to primary care practices for the most part. They're either on the street, they could be homeless, they could just be flushing in and out of emergency rooms and hospitals, et cetera. But they're really more comfortably being treated in community mental health. Community mental health has been out there forever, and they never had money. They were very poorly funded nationally at the time. Things have changed a lot since then. But what they did was they created programs and services that were so innovative because they were doing whatever they could to keep people in the community, out of the hospitals, and fully engaged. So we said, let's start there. I had relationships with different community mental health organizations around the state. Picked one who we work with very closely. I've been in this business for a long time, and basically said, let's try to partner together to do something different. Let's create a model that treats people like people, and I want you guys to be the quarterback. I'm not going to be all over you. I want you to be the quarterback for these members, because that's what you do. Have them come into the program. The program will consist of, when somebody walks through the door, no matter what the reason is they walk through the door, they are evaluated for their physical health, their behavioral health, as well as social determinants. You're not going to get treatment and commit to treatment if you don't have a roof over your head, food on your table, transportation to treatment. So you have to look at the entire picture. So again, community mental health had already started years ago doing these types of programs. So we're saying, let us work together to figure out how we can actually bring this to life for people with serious mental illness and substance use disorder, so they're not falling through the cracks.
That's an amazing way to look at it. The idea that, hey, a lot of this stuff, what I consider kind of last mile, or like a lot of things that weren't being addressed by that overall healthcare picture,
Right.
has actually been happening for a long time, but in
Yes.
these separate institutions.
Yep. And we tried to help to put, so it's not real simple, as you can imagine. So
Mhm.
we wound up giving seed money to these organizations to say, we're going to help you to actually have the infrastructure you need to be able to do this the way we need it to be done, because they're seeing a lot of Medicare and Medicaid patients. We said we wanted to have our commercially insured members be able to go there. Why? People think there's a big difference between Medicaid and commercial members. When you look at the profile of these people, they're not different. They have same issues, or their dependents have the same issues. So we said, this can work for anybody that's coming through the door. And so that's really where we started. And the results have just been amazing.
Well, speaking of the results, speaking of the start, and speaking of that focus on these community health organizations that have previously been underutilized,
Right.
somebody watching this, somebody like learning, because we're going to go deep into that NovaWell model.
Right.
What's one thing that you'd like somebody to take away from this conversation that we have?
So the first thing is, 67% of people that have a mental health condition don't get treatment because of stigma. So the most important thing to me is, if people realize there's not a one person that's standing on this earth, at least in this country that I'm aware of, that has not been impacted by mental health or substance use themselves, their family, their colleague. And we all have to start telling our stories, because they'll realize no matter where you sit in life, you could be the CEO of a corporation, you could be a line worker in an auto plant. We all have similar types of issues. So we want to make sure people know that that it's okay not to be okay. And there is so much help out there. You've got to be able to get to the point where you're willing to raise your hand saying, I need help. Because you'd be willing to raise your hand for your diabetes or for your heart disease. And your brain is part of your body. It's like a heart, lung, liver. We're all the same part of the same person, right? So what I would want to have people take away is, there is clearly the most wonderful thing you can do for yourself is raise your hand and get help. And from an insurer's perspective, what we need to do is not just wait for people to raise their hand, but find people who need help and tell them, we want to work with you and we want to help you get what you need.
Well, let's start with stories, because like one thing that I think is important, and the way that you opened up your session was with a personal story. And one thing that I think is powerful from that is that a lot of our personal stories are things that we have trouble even telling ourselves.
Right.
So to hear it vocalized and to not feel alone in the types of issues and the way that we've grown up, I would love for you to get yours out, and maybe I'll share a little bit of mine too, and then we can get deeper into, well, there's a reason that you're doing all this hard work, and I think it relates back to your personal story.
Absolutely. So I'm an Irish Catholic young woman. I was a young woman at one point. I'm now not a young woman, but I'm one of 8 kids. And I grew up in a house where my dad had an issue with alcoholism.
Mm.
And so there was alcoholism, there was domestic violence, there were all kinds of issues there that so many people experience in this country even today. And and at that time, when I was younger, I saw things that I would never want anybody else to see with my dad's behavior and things like that. But I really hated my father. And I didn't look at this as a health issue. I looked at it as just like everybody else did, a moral failing. There's something wrong with this person. He's not a good person. But then when I got into mental health, and it's been probably 30 years now, a little over 30 years, I learned over the course of time that this is an illness. And the fact that I started looking into his family history, it's generations of addiction. And then I looked on my mother's side. She was raped at 4 years old. And she was also the child of people with an alcohol issue.
Mm.
And then I have 2 nephews, one lost last year from drug-related issues. I have others that are in recovery. I have nieces and nephews that are struggling with anxiety. I mean, it's everywhere, every day. And the good news is we're able to talk about it now and try to say, it's okay. And I can look back on my dad and say, I couldn't forgive you while you were alive, but I certainly can now because I understand what happened there.
I really thank you for sharing that and going to the personal details. And maybe, I don't know, would it help if I reflect back on some of my own? Honestly, one thing that I've been grappling with heavily is I have a friend who was murdered 2 years ago. And when I think about that, I think about that often. Like, there's a lot of things that failed her in terms of like she had substance use problems as well. In association with the partner that she was with. This was a domestic issue, and he had a lot of things that were going unaddressed that could have been prevented had that right support been available. So the things that you're doing at NovaWell and the types of conversations that we're having and hoping to progress, I think that just have such a powerful impact. And as a data scientist, I can go all the way into talk about spreadsheets and aggregate trends and everything like that. But I think it's important to start off with that personal aspect.
And that's what we try to do on every panel I'm on. We make sure all my team members. I did a video for our employees when I first went there in 2017 for the employees of Horizon Blue Cross Blue Shield at large. And it was the first time I ever came out and had pictures of my humongous family and my parents and everything. And to go on video and say, here's my story. And the response I got from the organization was unbelievable. So many people saying, that's the kind of life I grew up with. Thank you so much. I have this, this, and this. And it's just like by telling stories, it really normalizes it. The people know that we're all struggling in one way, shape, or form and ask for help because, again, there's not that I don't want to say there's nothing different about you. There is something different about everybody's situation, but we all need to have access to the kind of care that's going to help us to get to where we need to be, just so we can live our daily lives.
So let's talk about some of the actions that you've been taking. And honestly, let's go all the way back to what triggered the assembly of that dream team. I'm curious about what the elements of the status quo that finally got the organization to say, hey, let's invest in this new approach. What's the status quo and what's your commitment to doing different?
So the status quo was, as I had mentioned earlier, that behavioral health was outsourced to another organization. And it's almost like never the twain shall meet. You guys go do your thing, we'll take care of the rest. But until you start looking at people as people, and the data is out there, as you're a data guy, data is out there showing that if you take care of people holistically, aside from fabulous outcomes for that person and a quality of life and good health, there's also tremendous savings opportunities from a health plan's perspective. You can reduce anywhere from 17 to 20% of total medical cost, by doing the right things for people.
Is that similar to what you're seeing in this model?
And so that's what we're all about. We are not an organization who's saying, let me just take behavioral health and go worry about it over here in my corner. We're saying, let's look at behavioral health in the context of total health care. So let's look at how we look at newly diagnosed diabetics, newly diagnosed oncology patients. The anxiety and stress that goes along with that are huge. How do I cope with my life? How do I live knowing that I don't know what tomorrow is going to bring? How do I talk to my kids about it? I mean, just from a chronic medical standpoint, there's so many opportunities to help from a behavioral health standpoint. Then conversely, on the behavioral health side, you have to look at that whole person as well. I can give you a quick story if you're interested in terms of one example.
Not just interested, but please.
Okay. So and again, we have so many stories like this, but when we first started this program where we said out in the community, we want that community mental health provider to actually become the quarterback of care for these members. There was a patient that came through, agreed to be part of the program, and they explained why there's a value to it. And he's in early 30s and had an opioid use disorder and was looking to get into recovery and had been in the hospital 4 or 5 times during the course of the prior year with emergency room visits happening as well. And he was recycling through the system, overdoses, etc. He enters the program, and the first thing they did was they did a full battery of tests for a physical. So they checked your heart, lungs, liver, blood pressure, but they also did a battery of blood work. At the same time, they did all the behavioral health assessments. And then they also looked at what's happening in your life. Had no job, no longer had a relationship with his family because of what was going on with his opioid use disorder. No place to live. And so his picture was not pretty. When they finished the testing and they looked at the results, there was something wrong with his thyroid. And so what did they do? Here's a guy, early recovery. The last thing he wants to hear is there's something wrong with me, other than what I'm here to deal with. But the folks that were there at the organization just literally embraced this guy and said, look, we need you to see an endocrinologist, I believe they went to. I'm not quite sure who they went to in the end, but they wanted to and they went with him to the appointment to make sure, A, that he went, and B, that he was comfortable, that he had support with him. Turns out he had thyroid cancer. So what did they do? Again, if you had an opioid use disorder and you're just in early recovery, you are going to probably just shut down and say, I'm just going back to where I was and I'm going to forget about all of this. That didn't happen. They kept him so engaged. They saw him through his treatment. He had his thyroid taken out. He had I believe he had radiation associated with it. They stayed with him the entire way. In all of this, he's sticking to his recovery on the opioid use side as well because he felt like he had such great support. By the end of the year, he was cancer-free. He was in recovery. He had reestablished a relationship with his family, and he had a job. And so this can happen if we do all the right things and put the whole puzzle together.
So a big part of the innovation was like, look, we can put technology aside for a second and just talk about this overall model.
Right.
That where like if behavioral health is just happening in isolation and these other things are happening in isolation, there's not that incentive to address.
Exactly. That's what it's all about. So it's really our NovaWell's, North Star is all about integrated care, treating people as people, not conditions.
Then with this being a new approach and a new focus, that sounds like it arises new metrics and things that you monitor.
Right.
Can you talk about some of the things that happen in aggregate and how that's communicated to leadership?
So we first started off when we started to develop the program, we started off in one county in New Jersey, and we were going to wait for the program to run a year. And then we needed to wait for claims to run through so we could say, okay, this is what we invested in the program. And this is what actually happened in claims as compared to what would have happened in prior periods. So just a lot of insurance stuff, but that's what you do. We saw one of the pieces of this is we measured patient experience the entire way through. So what we saw in the first 6 months is that we didn't have any data that says it was going to save money or any of those kind of things. We had data that said, my quality of life has changed dramatically. I am using X less than I used to do. This is all patient self-report, but it was hope. And so we said, you know what, we're not going to wait. We can see that this is truly making a difference, that we rolled it out across the state. And so what do we measure? Clearly, patient self-report is of huge value because one of the things I learned early on, as long as people have hope, there's hope. And so when you start seeing those kinds of statistics coming through and people are saying they are getting better, they are getting better. Now, having said that, we also look at the data end of it. And what we saw, again, because all of the organizations that we work with across the state, they're doing the exact same things that the first organization we piloted with, what we're seeing now is total medical expense, which is all of your costs for whatever you're having wrong, right or wrong with you, it reduced by 20%. That is a per member per month. That's huge, 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 huge. These individuals are generally running medical costs that are 3 times someone who doesn't have a behavioral health issue, 3 to 4 times. So we saw the total cost coming down. We saw 51% reduction in inpatient utilization. That's huge. 27% reduction in emergency room visits. So those are the quantified things that we could see from a dollar and cents perspective. But it all started with how the patients actually experienced what was happening with them and what the outcomes were from their perspective.
So earlier in the conversation, I believe you said, like, where the care goes, the dollars will follow.
Do the right things, and the money will follow.
See, you said it at the beginning, and I was like, that sounds good. But now you tell that story, and it just feels so real and so visceral.
Yeah, it truly is real.
Cool. Well, I'm actually like one thing that I find disappointing in a lot of data analysis is that people want to look at what fits neatly in the columns without reading the actual feedback and the qualitative part. So,
and we thought that was important, clearly, because you want to get back to, again, the hope and the opportunity for recovery and keeping people in recovery. Mental health issues are chronic health conditions, especially in the substance use world and in serious mental illness. This is not something that you take a pill and it's going to go away. This is something, it's a long journey. And so from our perspective as a health insurer, our goal is to keep that person's journey as much in the community with the right supports and everything, so you don't wind up being in the hospital, you don't wind up in the emergency room. It's treating them for as long as they need to be treated, but in a setting that will help them to have balance in their lives and have a good quality of life, but also keeps costs down.
Well, so one reason now I was really excited to have this conversation with you is that, like, by looking at that model, looking at some of these results, I'm hoping that some of our listeners, I'm hoping you're planting little NovaWell seeds across the nation here.
Thank you for saying that. Me too, because what we started, so the work that I started in 2017 was really for Horizon Blue Cross Blue Shield of New Jersey, and that's all that it was intended to be. But then about 3 years in, we had early results on all the programs we were implementing, and we were getting plans calling us saying, how are you doing that? Can you help us do it? Blah, blah, blah. And we thought, you know what? This is truly a passion for my team. So my dream team, they all have a story, whether it's themselves, their kids, their family, and they're all in it for the reason of we want to help change how things are happening in this country, how care is delivered from a behavioral health standpoint, and how we can intervene to help people that have not had help in the past. And so it's been an amazing journey. And as people were calling us, we said, you know what, maybe we should think about doing something differently. Maybe we can take this as a blueprint and take it across the country. So that's our goal, is basically to work with health plans, and we'll soon be working directly with employers to try to bring these kinds of solutions to the table.
So let's talk about that communication with the health plan. One thing that I would want to know is, if I'm taking on this model, I'm taking on this approach, what are some of the barriers? What are some of the resistance I might expect from other leaders, and how do I overcome?
So, when people think about behavioral health, they think that it's about 4 to 6% of the premium dollar. Not medical is billions. This could be millions, right? But we need leaders, and we're trying to help leaders understand is this little piece of the pie impacts about 20% or more of the rest of the pie. And if we do the right things together to deal with those issues for those members, you're going to see your total costs come down. So it's a lot of it is around, we started off by trying to say, take the, altruistic approach. It's like improving access, taking care of people, but we also have to be able to provide return on investment and things like that. So most plans want to do the right things for people, which is a beautiful thing. And they're really beginning to understand more and more the value of integration. There's just so many other things that they're trying to contend with. So our job is to kind of make this too good to be true and make it really good to be true, and have them want to sign on because they can see the results that we're experiencing directly today.
The beautiful thing about it is that it's in the data.
It's in the data.
Yeah, specifically, like I think that it's not in the data if you're looking at it in the wrong way. Right. Like there's one way where you can just isolate everything into behavioral health, cardiology, et cetera.
Exactly.
But when you look at that
Whole
in relation,
picture. Exactly.
look at how that impacts the movements there. So with the little NovaWell seeds and like let's say that you stay the course and stay optimistic about this.
Right.
What are you looking at 1, 2, 3 years in the future? What are some innovations that have you excited?
So we're helping plans that are outsourced to other vendors. We're saying, let us help you bring it in because we want to help you bring it in because then you can actually start really working on integrated care yourself because you have to change how you think about all of this to be able to really get to again, looking at it from the financial perspective, but it's also the outcomes are amazing. But we're also looking at now that we've had this about 18 months where we've been up and running, and we're looking at what populations definitely will get the interest of other organizations more quickly than trying to do something more holistically. So we're looking at children and basically it's called our youth and young adult program, because when you look at kids, the issues are all over the place. But when you start looking at young children, they've got a certain set of issues with autism and things like that. You look at middle school to high school kids, there's a different set of issues there. And then you look at kids that are in college, and the world has changed. And then those kids from college are going to graduate and go out into the world. So there's so many different levels of support that are needed to try to take care of youth while they're young so that they don't become the problems that we're seeing today in older adults, meaning anybody over 30 for the most part. But it's really trying to get to the kids when they're young and then really try to lay the groundwork for normalizing the conversation, knowing there's help available, working with schools and getting access to care in school versus trying to wait outside and going for appointments. They're trying to really just coordinate with the community as well as with the health plan and to really just try to do the right things for kids. But again, it's a long-term picture though. You're not going to necessarily see in the next 1 year, 2 year, 3 years, massive changes, but these are kids that are going to grow up. And you want to make sure this is the long-term game that you're going after.
So, and speaking of that, there's another component too that we haven't harped on it too heavily in this conversation, but it makes me wonder, like as NovaWell is a digital front door, are there technologies that you see within that basket of options that people have? Are there things that you would recommend people really start taking a serious look at?
Yeah, so we wanted to make sure that we had tools for people to use to just help them to understand what's going on with them, right? So I'm a parent and my kid is driving me crazy and they're not doing their homework. There are tools in there for parents to look at to say, hey, these are some of the things you should be thinking about. It's about parenting. There are opportunities for people to learn how to be a better parent in the world that we live in today. But it's also letting you know that there are tools there that you can use if you need help, you yourself or your child, as an example. And it really changes the game when you try to make it very user-friendly and you make it simple. Make it easy information to understand and an easy assessment to complete and an easy scheduling of an appointment, which has been, people have waited for months for an appointment with a psychiatrist. We have commitments from these organizations we work with for turnaround within a couple of days.
Wow.
So but there's a lot of accountability on their part. These are amazing provider organizations. We have vetted over 500 different digital and virtual solutions to come up with 20. We're at 20 right now. We will probably get to 30, 35 max, but it's really a lot of specialty services. But we hold them accountable to deliver very specific things to report back on patient outcomes. It's a beautiful relationship. If they do a great job, they'll be rewarded for doing a great job.
I'm going to look at the camera and address all the chief technology officers out there who have hundreds and hundreds of apps under their purview, but you say, hey, max 35.
Yeah, because and there are, I think there are like 16,000 or some ridiculous. I'm probably exaggerating.
No, you're not.
But it's huge. But you have to make sure that their evidence-based care, you don't need 100 different apps that will help somebody to help with their anxiety. You need a handful that are going to deal with whatever. You just can't contract with the entire world, which makes me feel bad because I can tell you every day, the newest shiny penny is coming to me saying, let me in your network, let me be in your program. And I would love to, but I need experience, I need outcomes, I need these kinds of things. And you have to start somewhere. But I had somebody today going through these amazing results. And I said, how many people went through the program? And they said 50. And I'm like, 50 is not going to do it for me. I have another one who's shown me fabulous outcomes. How many members go through? 5. That's not going to cut it, guys. So anyway, as much as you want to help, and everybody has great intention, but to me, it's also been most of the companies we work with, the people who are the CEO or leadership team are all people who have lived experience. And in the end, their investment in this is a little different than some of the others.
Well, that's a tremendous example, and I think that's our core audience isn't necessarily digital health vendors and creators, but I really do hope they kind of hear that message and hear about your commitment to working with these types of organizations. One thing that we offer to everybody, I know I think you've done this before, but we have a magic wand here. It doesn't necessarily it doesn't work in the real world, but we can have this imagined future here. So the magic wand allows you to change one thing about how healthcare is delivered. So if we were to give you that magic wand, that superpower, what would that be?
It would be that stigmas erased in such a way that everybody that's at the table, whether it's a cardiologist, oncologist, a primary care doc, everybody thinks of mental health as part of the illness. And so that it's always being addressed regardless of who you're seeing, rather than have it all be people over here, they're handling this. This is one of the things I talked about at the conference today, is like everybody in the room is out of mental health. We need to have other specialties here who see this every day. And there are so many more of them than behavioral health resources. And so we have to start hitting these issues at those provider organizations to help people to get what they need early on without, and while we save the behavioral health professionals for the more seriously ill patients.
So I'm going to make a confession here. I have only been in the digital mental health space since May of 2022. So I'm kind of on 2 years. Yeah. But one thing that really surprised me was I was sitting next to an orthopedic surgeon at some point, and told him about the WOBOT, and he spoke about how he wishes there was a mental health solution for people who've been told that they need to come in and have bone surgery. So that's a major, like I was like, it just really speaks to your point.
Absolutely.
Yeah, he was looking outside of just that. Yeah. I'm not in a bucket here.
Exactly.
Mental health is a factor.
Exactly. It needs to be, and it's got to start in medical school. It's got to start in some of the other practitioners that are, because the treatment team is getting very diverse now because there's just not enough within the behavioral health world. So between peer support, huge benefits from peer support, but most insurers don't pay for it. There are huge benefits with community health workers. It's you've got to really look at the whole picture. But then when you start looking at primary care, 80% of antidepressants are prescribed in primary care. Many of them are not, they're either underdosed or because they're not comfortable with the topic necessarily. We just have education, hand-holding, partnerships, so much of that has to happen nationally.
Well, I commend you on bringing that model out to the public, getting people to think about that whole person perspective, because Pandora's box is open. It's not going away.
Yes, that's for sure. Thank God.
Indeed. Yeah. So thank you for carrying that torch.
Yeah.
Now, another question that I have for you is, like, I know that you were really transparent about that NovaWell model and showed a lot of leadership, but I always wonder about who you follow, who the leaders follow, and like, whether it be people on LinkedIn or different publications. Like, what's your favorite place to gain new knowledge?
I read everything. So so it's really important to hear what's coming from the feds, right? So SAMHSA, CMS, those types of organizations are critical. I need to hear about what the provider communities are thinking about and talking about. So AMA, APA, those kinds of organizations. But I also like to hear about success stories with people. And so to me, I learn a lot more from hearing somebody else's story about what worked, what didn't work, what should we be thinking about different. Those are the things to me that make all the difference in the world, because it's live experience and it's people who have really struggled to get through the system. I work in this health system, and it is a challenge for any of us to try to get care as we try to look at for family members or friends. So it's just trying to hear stories from people about what they've experienced for themselves, their family member, et cetera, and then take what you hear from that and turn that into some action.
Second time that we've asked this question. It was brand new. Second time that we've asked it. And also the second time, someone advocated listening to people, listening to patients, listening to people who have these experiences. So well, I want to see how this trend goes. I love this question. So flipping it around, people that want to follow you, what's the best way they can keep up with what you're doing?
So I'm on LinkedIn. So it's Suzanne Kunis on LinkedIn. And I also have a NovaWell email address. It's Suzanne_Kunis@novawell.com.
All right. Well, thank you very much. And looking forward to, as you go from conference to conference and having these conversations, let's see these NovaWell seeds start to sprout.
Thanks, Chris. I hope you're right.
Really appreciate the conversation. And for everybody who has joined us, I did reference a conversation that we had with Dr. David Koval. That should be appearing on your screen, but it looks at the relationship, and an unlikely relationship if you're not familiar with whole health, but that relationship between orthopedic surgery and mental health.
There you go.
But with that, thank you very much, and we will see you next time.